Good morning, Peter Goertz. I'm a psychiatrist. Why is there so much suffering in this world? So, does life have to be torture? Does your life feel like torture? And it can. So, I'm joking about it, but it definitely can feel like someone's torturing you intentionally and again. There are obstacles and all kinds of challenges, problems, really painful experiences. So life really can feel like torture. But does it have to be? Does it have to feel that way? In my opinion, not. And these are simple issues in a way, but they're not easy at all. So life is full of challenges. Someone can win the lotto and then the next day their son gets arrested. So you're never going to be free from challenges in this life. And from the perspective of the psychiatrist, you constantly hear about all kinds of challenges, very painful experiences, despair, physical problems. And what led me to bring this up this week is I see a good amount of patients who are getting evaluated for transplants like liver transplant, kidney transplant, and these people go through a whole lot. So the patient I saw this past week was getting ready for a possible kidney transplant, and he'd been going through a lot for years and years physically, and that of course affects people's mental state. So as a psychiatrist and as any kind of doctor, you want to try and avoid burnout. And one thing to look at in order to avoid burnout as a physician is how you deal with constantly hearing about despair, challenges, so much suffering. So what you hear about as a doctor and in life in general, and especially as a psychiatrist, is again, all kinds of challenges, abuse in childhood, physical abuse, sexual abuse in childhood. I used to work at the VA, so I heard a lot about terrible experiences in Vietnam and combat by veterans. People will tell you their parent died in front of them when they were young. People are born with genetic abnormalities, trisomy 18, Down syndrome, terrible things. And Down syndrome, interestingly, a lot of people with Down syndrome are very happy people. So a lot depends on people's perspective and not necessarily on what the actual situation is. And I see a lot of people with Alzheimer's, dementia, and that can be very painful for the patient and for the family. So one thing that helps me to try and cope with all this, and does help me cope with it, is to see this whole world as a learning center, a school, basically a place where we're all learning, and these learning experiences can be very painful. They can be related to having physical problems. You can learn from that. And I'm not dismissing these things. I'm not speaking lightly about them, but I do feel that if you see these things as a learning experience, they can really be transformed, and people in pretty much any situation can derive some enjoyment from life. So these experiences, any painful experience, any experience, can help us grow emotionally, spiritually, and can help us to let go of the past, not dwell on the future or the past, and do our best to be in the present moment and enjoy ourselves in the present moment, which is simple, but of course not easy. Thank you.